Hey YouTube, it's New 211 coming to you with a video about my fibroid experience. I'm sitting by my window, so it's a little washed out, but it is a brighter part of the house. I wanted to kind of make this a women's health series. I was diagnosed with having uterine fibroids a year and a half ago. I went to the doctor for a normal checkup, the gynecologist, and she was performing a physical examination. And she was feeling my abdominal area and said, I think you have a fibroid here. And actually, I could feel what she was touching on. It was something that was hard. She explained to me that a fibroid was mostly non cancerous, like mostly as in almost always a non cancerous growth that attached to your uterus, was either inside or outside of your uterus, and that mine was probably on the outside. So I got an ultrasound performed at an imaging center and reported back to my doctor for the analysis. And based on what she told me, I had a pedunculated fibroid and uterine wall. So pedunculated, instead of it growing like into the fiber of the uterus itself or the lining of the uterus or the tissue of the uterus, it's either on the inside or the outside, but it's connected by a stalk. So mine was connected by a stalk, and it was on the outside, and it was about 4 centimeters in size. Now, I had for years experienced terrible periods, heavy bleeding, vomiting, fainting, associated with anemia. I had to call out from work. I would be in so much pain that I would crawl on the ground in pain. And there would be almost nothing that could help me because you can't really take medicine to alleviate your period pain if you're vomiting it up, just being honest. So I was in a lot of pain, and she said that the fibroid was probably, at least contributing to that. So I asked her what I should do, and she said that I should probably go on birth control because the birth control, in her opinion, could help to shrink the fibroid or to keep it from increasing in size. Well, I went on birth control, and I'll make a separate video about my birth control experience and also about my painful period experience. Um, and I will go into that in more detail later. But I went on the birth control, and a bunch of things happened as a result of that. But what did not happen was a shrinking in my fibroid. My fibroid did not get smaller. It did not remain the same. It actually grew to the point where it became noticeable. When I would try to button up my clothes, I would feel this hard growth underneath my skin. I started to have a lot of urgency with going to the bathroom, meaning that I felt a lot of, if my bladder would be slightly full and I drank a lot of water, if my bladder would be slightly full, then I would have to go to the bathroom right away. And it was just, terrible, absolutely painful, horrendous, and embarrassing to risk wetting yourself all the time. My periods became worse. They did not get any better under the birth control. My bleeding became heavier. My periods were lasting. They would last before maybe 4 to 5 days. Now they were lasting 7 days at the least. Sometimes 8 days, sometimes 9 days. I just felt like I was bleeding all the time. It was so ridiculous. The period between the time frame between which I was menstruating and when I for 1 month and then menstruating for the next month was shortened because my periods were so long. So I felt like I was always menstruating. I felt like I was always on my period, and it was very frustrating. Anyway, so this doctor sent me back in for another ultrasound, and that ultrasound told me that the fibroid had grown, that it was now 7 centimeters. So it had gone from 4 centimeters to 7 centimeters, that I had, like, it was almost like I was pregnant, basically. Because if you think about it, when a woman is trying to give, this is like to give you perspective that my doctor gave me, who actually performed my surgery, and I'll talk about that in a little bit. When you give birth to a baby, like if you decide to have a baby, you give birth, a woman is supposed to be dilated 10 centimeters in order to push the baby out. And the head and the shoulders are the bigger part of the baby. So most babies have a head circumference of about 9 to 10 centimeters because you have to be at least that to push the baby out, right? To start the pushing process. And my fibroid at that time was 7 centimeters. So think about a 9-month-old baby in the womb is about 9 to 10 centimeters in circumference of their head, and mine was only 2 centimeters under that. So mine was like the size of a growing child, like the head of a growing child was inside of my body. Then the ultrasounds also revealed that I had another fibroid that was not just pedunculated and on the outside, but actually was attached to the uterine wall on the inside. So basically, your uterus, um, um, your uterus is like this. I don't know if you could see that. Okay, so that's kind of what your uterus is like, and it was attached. There's this like stem or line where you have your cervix, and then there's like the stem where, for example, if you have your period, everything comes out of there, or if you are going to get pregnant, the sperm goes into there. That line right there, I'm sure there's a technical line, but anyway, that's where my fibroid was. It was in between, in that line right there. So there was no way I could have gotten pregnant, because not that I was trying to get pregnant. I'm not married. I don't want to have a child until I get married. That's if I get married. So I don't know if I want to have children or not, good. But God willing, if that happens, that happens under the right circumstances. But if I wanted to, I could not have done that, because the it was blocked. Basically nothing was going in, nothing was coming out. That's another reason that my periods were so heavy. So although this one was small, it was only about a centimeter or two, it's like between 1 and 2 centimeters, it was causing me a lot of issues because it was blocking my period, in turn causing me a lot of pain and discomfort. Basically my uterus was contracting a lot in order to push out, we call it blood. It's not really all blood, but to push out the period matter. Okay, and this is also why when I would ovulate, that's another thing. When I would ovulate, I would face a lot of cramping during ovulation. So basically, like, you ovulate between when you stop your period and when you begin your period. So I'm getting cramps not only the day of my period or the day after, but also in the time period where I'm ovulating or where I'm fertile, I'm getting a lot of discomfort and cramping, because that fibroid was in there causing a lot of issues. So the smaller fibroid probably caused me more pain. The doctor continued me on a course of uh, birth control, which again was not working, and I told her it was not working. I said, I think that I need to have these fibroids removed, because not only was I getting heavy cramping during my periods, I was also having the issues with my bladder. I was also feeling the pressure. So like if I would press on my abdomen, then I would feel like, at the time my abdomen was relatively flat. I just had surgery, so it's very bloated right now because, and I'll get into that, but they pumped me full of water when they performed the surgery, so I've still got that water a week later in my abdomen. But I work out quite a bit, so despite the fact that I'm actually pretty like soft right now, because I haven't been exercising for the past 2 weeks because of this issue, and then also I'm still bloated from surgery, but my stomach was relatively flat. I had like a little to no fat on my abdominal area. I carry most of my fat in my arms and my legs. And so I would be able to, even standing up, see this little, like this, if this is my abdomen, then there would be like this little lump right here to the right side of my abdomen underneath my belly button. And it was getting bigger and it was getting harder, and my urination became more difficult, and I was getting UTIs very frequently, and I think that has something to do with it. Anyway, I don't know this for a fact at the time, because my doctor kept telling me, no, this birth control is going to shrink it, you're fine. So she sends me to go get another ultrasound, and now my fibroid has gone in the course of a year from 4 centimeters to 6 centimeters to 7 centimeters. And at my last ultrasound with her, so I've done like 4 ultrasounds with her. My last ultrasound with her, my fibroid is 8 centimeters. Okay, that's huge. That is really big, to have something that is like another organ inside of your body where it's not meant to be. Your body is not pregnant. Your body is not prepared to expand, but you have something expanding into your abdomen and attaching itself to your uterus and pushing against all your organs. And the doctor is telling me that I'm fine. Fibroids are very common amongst Black women, and I'm fine. So anyway, I went back to her. This is the last time that I went to her, one of the last times, and she referred me to a specialist. The specialist that she referred me to was a fertility specialist, and I was like, because she said, you want to know if you'll be able to get pregnant. Let me send you to this fertility specialist. So I go to Baltimore, Maryland. I live in Salisbury, Maryland, on the Eastern Shore. So Baltimore, Maryland is 2.5 hours away from Salisbury, Maryland. I go to Baltimore, Maryland to see the specialist, who basically tells me and pay this ridiculous copay because he's a specialist. That he doesn't know, and doesn't really matter what he does because his specialization is not fibroids, it's fertility, and he has had women get pregnant with fibroids after treatment. Whether they have it removed or not, he's had them get pregnant, but he can't guarantee for me that I'd be able to get pregnant if I wanted to. And this is so premature anyway because you're not married and you don't want kids right now, so why are you even worrying about it? And this is not anything against him because actually he's saying exactly what he should say, which is, I'm a fertility doctor. If you're not trying to get pregnant right now, why are you seeing me? The issue is with my gynecologist, who is sending me to a fertility specialist when she should send me to someone who's a fibroid specialist who can tell me if I need to have this fibroid removed or not. About the fact that I asked her to do whether or not I should have this surgery, I thought I was confiding in someone or asking an opinion from someone who had actually performed the surgery, because that's what she led me to believe. She says, we can just, since yours is pedunculated and it's on the outside, we can just go in there and snip it off, no problem. So, don't even worry about that, but don't you want to try to avoid surgery? And I remember having this conversation with her and saying to her, and her saying to me, I performed this surgery on somebody who was pregnant when we did a C-section on her, and then I cut the fibroid off after we finished the C-section and then closed her up. So I know she told me that she did the fibroid surgery before. Come to find out later on, I had a friend of mine go to the same doctor. This is a very small town, and I had referred my friend to this doctor because my friend had polyps that needed to be removed, and the doctor told her, oh, I don't do surgery. So that's very frustrating to find out way after the fact. And this is after I decided to stop going to her. Anyway, I became discouraged as a result of this. And I want to tell you guys this to basically tell you to be proactive about your health, especially if you are an African American woman, a Latino woman, a woman of low financial means. That doesn't necessarily apply to me anymore, but I used to be of very low financial means, very poor, so I didn't have any health insurance. I do have health insurance now. I do have a job that does guarantee me time off and leave, but you have to be your best advocate. You have to do as much research as possible, ask as many professionals as possible, because they do not take us seriously. They don't think that we'll sue. They don't think that we'll do certain things, and so they need to have a healthy fear of you, and you need to be your best advocate and speak up for yourself. However, this doctor, for some reason, didn't know who she was messing with and did not take me seriously. Anyway, by the time I stopped going to her, I'm at an 8 centimeter fibroid on the outside and a 2+ centimeter fibroid on the inside. And that was about, I would say, 6 months ago that I stopped seeing her, because it was about a year that I tried to work with her and got nowhere, basically, other than getting prescribed birth control over and over again that was not doing anything and was causing its own issues. So I became disenchanted with her and upset, and I just kind of dropped off the map as far as taking care of my gynecological health, and that's on me. So I went about my life, and the fibroid, I could ignore the fibroid for the most part, except for when I was on my period. Well, then I started getting UTIs very frequently. I mean, one would clear up, another one would come. One would clear up, another one would come. It was so ridiculous. I was getting prescribed Cipro so much. I was drinking cranberry juice by the tons. I would say that in the year 2015, I probably had about 10 UTIs in like a 6-month period. It's ridiculous. So it was in the month of January. I was on my way to work, and I got my period, and I felt like I was going to faint. Like, I could not drive. I couldn't drive. I started driving, and then I pulled over and parked my car. and sat on the side of the road, and I called out from work, and I just couldn't make it. I wasn't going to be able to drive. I was in excruciating pain. I was taking medication, and then I began to vomit. And I hadn't vomited in quite some time, and it was very disturbing and upsetting, and I was just like in so much pain. And then it wasn't just cramping, which was already bad. It was also this searing kind of cutting kind of pain, and I felt like my uterus was going to fall out. Like I felt like pressure down there, and I felt like contracting and pulsing, and I said, I'm not dealing with this anymore. This fibroid has got to go, because I'm thinking especially the one on the outside, the one on the inside too, but the one on the outside is the one that I can see through my skin. I can see it protruding through my skin. So I'm saying to myself, okay, I'm going to get this taken out. I'm going to do something about this. So I went on the good old Google machine, and I looked up best fibroid doctor in Maryland, or fibroid specialist in Maryland, and the Johns Hopkins Fibroid Center was the first place to come up. I make an appointment with Dr. Fader for later on in that week. I take off from work again to go to Dr. Fader's office. I meet with her. It was very professional office. They performed a cervical biopsy, so they biopsed my cervix to see, because another thing is that now I had started to develop cysts on my ovaries. So ovarian cysts, uterine fibroids, and that are growing quickly. I mean, mine was growing very quickly. In the span of 7-8 months, it had gone from 4 centimeters to 8 to 9 centimeters. So that's really fast. It's fast growth. So they wanted to see if there was like any type of cervical cancer or anything like that there. So she sent me off for a biopsy. She had them do an MRI on me, because that gives better imaging of the area. She ordered my previous ultrasounds from the imaging center here on the Eastern Shore, and then she submitted me for a new ultrasound to make sure that it hasn't grown too much. So all the new testing showed that it was over 9 centimeters. So it had gone from 4 centimeters to 9 centimeters, which is like the size of a baby's head. It was like this big, okay? About that big inside my body. It was, from the ultrasound, it was pushing on my ureters. It was pushing up against my bladder. It was pushing up against my kidneys. It was obviously pushing down against my uterus, even though it was pedunculated, because it was attached to the stalk. There was like a little stalk that it was attached to, right? And then you had, so I think the uterus, I think it was like twice the size of my uterus. So my uterus is like 4 centimeters maybe, and the fibroid is about 9 centimeters, so it was more than twice the size. And it had started not to just be a round circle, it also had grown like this lump in the back, and the lump was pushing back down onto my uterus. Anyway, she told me that they may be able to perform the surgery robotically, that if it had been smaller and they had removed it earlier, that they definitely would have been able to do it robotically. But because of its size, there's a possibility that they may not be able to do it robotically. That what they were going to do is make an incision and go in and put a bag around. Basically, what they would do is disconnect the fibroid from my uterus, and they would put the fibroid into a bag. And then from the outside, using robotic technology, so they would put like robot arms in my stomach, right? And then they would break up the fibroid into little pieces, or into smaller pieces, and then they would remove the fibroid from the bag in pieces. But she said the issue with that is that if she goes in there and she cuts into it and it's looking like cancer, if she can get a piece out, looks at it under the microscope and it doesn't look right, or if she can see visually it doesn't look right, she's not going to do that. In fact, what she would do is then close up the small incision and then make a larger incision, like a C-section incision, and then remove the entire fibroid whole, instead of risking, even though it's inside of a bag, risking spreading cancer throughout my body. She also said that she would perform a DNC, and that's where she would go into my uterus through the rope, still robotically, make a small incision in my uterus, and then scrape the lining of my uterus and take out the smaller fibroid, the one that was causing me all the cramping and pain. Well, what they assume is causing me all the cramping and pain. So I contacted this lady in January. I did all my testing, and I had my surgery March 23rd. I was with this idiot excuse me, I'm being rude, but I was with this other doctor for a year maybe. I'm not quite sure how long I was with her before I just gave up the ghost, but I think it was like a year, and she didn't do anything but keep prescribing me birth control pills. This lady took a day of looking at my ultrasound results and my MRI results to say, this needs to come out. No one should have anything in their body this big, you know? And it was at the Weinberg Cancer Center is where I had it done, because it's, again, it wasn't at that point confirmed to be any type of cancer. It still has not been. I don't want you guys to think I have cancer. I don't. And by the grace of God, I do not. But it's still a tumor. And so, whether a tumor is benign or malignant, if you need to have it removed, you need to have it removed. And so it's going to be the same type of, surgical center. So they wheeled me in, and I remember they kept asking me about like allergies and things like that. And I have like a shellfish allergy and a latex allergy. And the doctor wasn't. I spoke to the doctor's attendings and her, her associates. Like, there were like younger doctors that worked underneath her. Those are the ones that came and spoke to me while I was getting ready for surgery. But she was in the actual surgical room itself, which is cool because I went in. She had her mask on and everything, but I could already recognize her. She had like, I don't know what it is about her. Like, Dr. Fader has like a good soul kind of thing. Like you can like read someone how they're like a good person, and that really shouldn't matter because you can be a good doctor and a bad person, or a bad doctor and a good person, but bedside manner is really important. She just has like crinkly, like kind of Santa Claus like eyes, just like, oh, your soul is so nice. That's how she was. So anyway, I went in and I recognized her right away. They were probably already pumping me with drugs. I don't even know, but I was just like, hey guys, you're gonna do great. I'm like encouraging them. Thank you so much. I can't wait to have this surgery and get rid of this thing. And they were chuckling, and then I remember asking them if they could take a picture of the fibroid, because I'm not scared of blood. I wanted to see what it looked like, because I'm a weirdo. And I wanted to see what it looked like. But they said, we don't know because we're going to try to do it microscopically. If we have to remove the whole thing, then we can take a picture. Or we can't just like shove a camera down you and, it might not happen. Even though they do have a camera in there to help them like break it up and everything. But it's not like, it doesn't give you like a holistic picture. You just see the little pieces of it. So anyway, I'm like talking to them, and the next thing I know, the lady is telling me, okay, Natalie, it's time to get up. And I'm saying, oh, are we going to surgery now, or what's the situation? And she was like, no, you've already had the surgery. And I was like, what? I just wiped my hands down with sanitizer. This right here, that's where the fibroid came out of, and that's the one that has stitches. So that's the one that, if it doesn't heal right, I might get a new tattoo right here because there's a lot of stitches there. But the stitches should dissolve on their own, and it feels really hard and tough right here. Like the skin feels taut underneath it. Yeah, it just feels crazy weird. This right here, this here, and then this here, this is where the robot arms went. So they put the arms, the robot in here, and they cut up here to gain like access, like to put, I think they put the camera in here. Now, I'm not sure what this one's for, but these kind of just feel like little ouchies right now. They don't really feel that bad, like at all. They don't feel bad at all. But this one still hurts because they cut my belly button, if you can see that, and my happy trail. They cut my belly button, and that's fucking gross, man. I don't know why, but like the sensation of your belly button being cut is so weird to me. So that's it. And as you can see, there's a lot of water here. Which is just, I've never had an abdomen look like this. It's so crazy. But yeah, other than like down here, this is like where the fibroid was like protruding from. But I can feel that there's no fibroid in there now. And it's crazy to feel that there's no fibroid because I got used to it being there. Yeah, so these are glued up. These are glued. Glue. And then this one here, this big mamma jamma. Can you see that? Focus. This big mamma jamma right here, that's a stitches.